Washington State, one of just 14 states that operates its own site and health insurance marketplace. So how are the enrollment numbers here? Well, KXLY4's Kylee Cruz live in the studio tonight, breaking down the statewide healthcare sign-up statistics. Kylee?
Well, Nadine, compared to most states, the sign-up numbers in Washington are much better. In fact, Washington is third out of 50 states for enrollment numbers. And that is due in part to the fact that Washington created its own insurance exchange rather than relying on the federal government.
So here's another plan too.
When shopping for insurance, Dale McCauley wants to make sure his wife Rosa has the best plan. That's why he likes meeting face to face.
I tried to get online and I couldn't figure out what button to push.
While McCauley doesn't want to shop online for insurance, others do. Nearly 660,000 people have visited Washington's Health Plan Finders website. 77,000 have signed up for insurance, roughly 9,000 through private health plans, 68,000 through Medicaid.
It says there's 38 different plans.
Kurt Fackler runs Better Health Together, an in-person assistance group that helps people enroll in health care through the state's exchange.
We've been able to solve a lot of problems and just answer questions, and people do like that personal touch.
Fackler says roughly 90% of those enrolled are singles. So how much does it cost? Fackler helped us crunch the numbers. Take, for instance, a 30-year-old man living in Spokane, making $25 grand a year. In one plan, he could pay $117 a month. Another plan with a lower deductible, $167. Unlike the federal site, you can shop online without filling out an application.
Process is a lot quicker and a lot easier. Now, once you decide what you want, now you can go in and create an application.
The state's website hasn't been met without glitches. It had to be shut down the first day it launched. But most of the problems have been fixed. Despite that, McCauley still wants to meet in person so he can get help navigating the healthcare maze.
She's healthy, but in case she does get ill, once there's something to fall back on, instead of paying for everything.
Now, in order to be insured by January 1st, you have to sign up and pay by December 23rd. So about another month and a half left to do that. And probably best to do that in the next month or so, as opposed to waiting till the very end.
No kidding. Well, time's running out, too. So where can people go to talk in person with someone and sign up?
And there's actually, and I actually found that surprising, there's a lot of places that you can go to. The Chaz clinics, some of the Chaz clinics, libraries in town, and you can go, you know, and a lot of times I think people like the face-to-face communication, kind of like a travel agent, so they can go over all of your options for you, kind of compare different deductibles, different rates, and all of that. And to find out where all those locations are at, we have posted a link on our website, that is KXLY.com. Just click on that News Links tab, and it'll show you everything for 13 counties in eastern Washington. So even if you don't live in Spokane County and you're watching from another county, that information is on the website.
You have to make an appointment?
You can walk in. Some of them just depend. Some of them you need to make an appointment. Some of them you can walk in, but it'll specify with that location.
All right. Thanks a lot, Kylee.
Thank you.